Hey everyone, and welcome to MediByte. We're all about giving you clear, reliable health information. And today, we're diving into a topic that so many people have questions about, but maybe feel a little hesitant to ask: vaginal itching and discharge. It's something a lot of us experience, but it can be really confusing. Is what's happening normal, or is it a sign you should be worried? Figuring out how to read these signals from your body is a huge part of understanding your overall health. So let's get into it. All right, so here's our game plan for today. We're going to break it all down step by step. First, we'll talk about what normal discharge even is. Then we'll look at the signs that might point to a problem. After that, we'll explore the most common causes, cover when it's definitely time to see a doctor, and we'll wrap up with some great tips for vaginal health.
Okay, first things first. Let's talk about what's completely 100% normal. This is so important because not all discharge is a bad thing. Actually, it's often a sign that your body is healthy and doing exactly what it's supposed to do.
It really helps to think of discharge as a feature, not a flaw. Your body has this amazing built-in housekeeping system. Cells in the vagina and glands in the cervix work together to create this fluid that naturally keeps everything clean and moisturized. It's pretty cool when you think about it. So, how do you know if what you're seeing is that normal, healthy discharge? Well, there are 4 key things to look for. First, the color. It should be either clear or kind of a milky white. Second, its consistency is usually pretty thin. Third, you'll typically only see a small amount. And finally, and this is a big one, it should be odorless. That's your healthy baseline. But that baseline isn't set in stone. It can and it will change. The biggest reason for this is hormones, especially estrogen. You might notice things look or feel a little different around ovulation or during pregnancy, or even if you're taking certain meds like birth control. These kinds of variations, also totally normal. Okay, so now that we have a really solid idea of what's normal, let's flip the script and talk about the signs that might mean something's up. These are the red flags you'll want to watch out for. This chart really lays it out clearly. See the difference? If the color changes to gray, green, or yellow, that's a potential heads up. Any kind of foul or fishy smell is another major sign. If it suddenly gets a lot thicker, sometimes looking kind of like cottage cheese, that's something to note. And honestly, the biggest clue is the sensation. If it comes with itching, burning, or soreness, your body is definitely trying to tell you something. So if you're noticing these changes, the next question is why? What's actually causing this? Let's unpack the most common reasons behind these symptoms. The number one culprit, most of the time, is an infection. See, the vagina has its own little ecosystem of bacteria, its microbiome. It's supposed to have a healthy balance of good bacteria that keeps everything slightly acidic. But if that delicate balance gets thrown off, it can give harmful bacteria or yeast a chance to take over, and that's when an infection starts. And it's so important to know that different infections show up in different ways. For bacterial vaginosis, or BV, you're often looking at a thin, grayish discharge with a distinct fishy odor. A yeast infection, on the other hand, usually means a thick, white, clumpy discharge and some pretty intense itching. Then there's trichomoniasis, which is an STI. That can cause a frothy yellow-green discharge, often with a fishy smell and irritation. But hey, it's not always an infection. Sometimes the cause is something external. Harsh chemicals that you find in a lot of everyday products can really irritate the sensitive skin down there. We're talking about things like scented soaps, strong laundry detergents, bubble baths, even some feminine sprays. They can easily trigger itching, inflammation, and discharge. Hormones can play a big part here too, especially after menopause. When estrogen levels drop significantly, vaginal tissues can get thinner, drier, and less stretchy. This condition is sometimes called genitourinary syndrome of menopause. All that means is it can lead to ongoing irritation, itching, and sometimes even a watery discharge. So with all this information, here's the million-dollar question. When do you need to stop guessing and go see a doctor? Let's walk through a clear action plan. It's definitely time to call your doctor if you have a fever or any pain in your pelvis along with your other symptoms. Any bloody discharge is a major reason to get checked out, especially if you're past menopause. And while it's rare, if you ever see stool in your discharge, that's a serious sign. On a more practical level, if your symptoms are just really severe, if they're not getting better after a few days, or if they keep coming back, it's time to get a professional opinion. All right, let's shift gears to some positive, proactive stuff. What can you actually do to help prevent these problems and keep your vaginal environment healthy and happy? Here are a few really simple steps.
First up, choose cotton underwear. It's just way more breathable than synthetic fabrics like nylon or spandex. Second, try to keep the area dry. That means changing out of wet bathing suits or sweaty gym clothes as soon as you can. Third, go for unscented products whenever possible. That means gentle soaps, detergents, and toilet paper. And finally, and this is a big one, avoid douching. Your vagina cleans itself perfectly well, and douching can actually mess up that natural bacterial balance, increasing your risk of infection. And that really brings us to the most important takeaway from all of this. It all boils down to knowledge. When you truly understand what's normal for your body, you're so much more empowered to notice when something's off and to take the right steps to take care of yourself.
We really hope this explainer was helpful and cleared some things up for you. If you found it valuable, we'd love it if you'd give it a like and share it with someone who might need it. And, of course, make sure you subscribe to MediByte for more health explainers you can trust. Thanks so much for watching.